Good afternoon, everyone. Welcome to the Mariposa Community Health Center session, Facebook Live. Today, we're going to record it and release it this afternoon. Um, my name is Eladio Pereira. I'm the Chief Medical Officer of Mariposa Community Health Center here in Nogales, Arizona. And this is a follow-up session. So the ones we've done before on community education on various topics that we've done in the past. Today, we have a distinguished group of leaders in Southern Arizona to speak to us about hypertension. Mariposa Health Center, El Rio Health Center, Pima County Health, and Chiricahua and others are engaging in enhancing the awareness of elevated blood pressure or hypertension and the importance of identify when it's abnormal and how to treat it properly. So our goal today is to review about 10, 12 items that would be useful to our viewers on various topics on hypertension. We'll be making it fairly simple so that our viewers can have an understanding of why we treat high blood pressure and what would be the proper treatment. I'd like to introduce our guest today, if I may. Dr. Lisa Soltani is with us. She is a primary care physician and medical director at El Rio Health in Tucson, Arizona. She's been there for about 20 years. She cares for both patients in the clinic and in the hospital. She is board certified in internal medicine and clinical informatics, and she also has a master in public health in epidemiology. She serves as a national clinical advisor for the National Association of Community Health Centers Million Hearts Preventing Heart Attacks and Strokes program. Of her several roles, she values most the deep relationship she has built over many years with her primary care patients and the health of her community here in Southern Arizona. Welcome, Dr. Soltani. With us as well is Dr. Teresa Cullen. She is a family physician and a clinical informatics expert and has led numerous large-scale health IT software development and deployment initiatives throughout her time in public service. Dr. Cullen became the public health director of Pima County, Arizona in May of 2020. In this role, she has helped guide the county of over 1 million residents through the COVID-19 pandemic. She has developed an integrated data analytics team focusing on community engagement, human-centered design, and public sharing of data through dynamic dashboards. In addition, she has developed a strategic approach to transformational health status change with a goal to helping achieve health equity. Welcome, Dr. Cullen. Um, we also want to talk a little bit about pediatrics and elevated blood pressure. And with me is Dr. Darlene Melk. Uh, Dr. Melk graduated from the University of Arizona Medical School in 2002 and completed her pediatrics training at Phoenix Children's in 2005. She worked initially at an FQAC in Phoenix, Mountain Park Community Health Center, and in 2010 was hired as a part-time pediatrician to work in a mobile clinic in southeastern Arizona at Chiricahua Health Center. She quickly learned and was promoted, and in 2020, she became the chief medical officer. And Chiricahua Community Health Center is now the largest primary care provider of Cochise County, serving over 32,000 patients. About half of them are children. In addition, she's done a lot of nonprofit work in Bolivia managing special needs patients. So welcome, Dr. Melk. And with me is my esteemed colleague, Dr. Phil Williams. Dr. Williams is a board certified pediatrician who came to us about 12 years ago as a full-time pediatrician, and now is the associate medical director at Mariposa Community Health Centers. His interests has been, of course, the COVID-19 pandemic, vaccine management, and obviously the clinical care of our pediatric patients. He's also an advisor on numerous activities at Mariposa. So welcome the entire, and we'll start. We'll talk about high blood pressure and the importance of high blood pressure. I think my first question it's going to be for Dr. Soltani. And the first question is, what is hypertension? How do we define it? And why it's important to treat it? Many patients say, my blood pressure is high, but I feel well. And certainly that's a challenge for us to explain that. So Dr. Soltani, can you tell us a little bit about that?
Sure, I'd be glad to. And first of all, thank you so much for inviting me. It's just such an honor. Many of my healthcare heroes are here on the call with me today, and I'm just so proud to be here. Many of us have come through a very stressful time in the last few years, and it just does my heart good to see people happy and thriving now. So, this is one of my favorite topics to think and talk about, and I think part of it is exactly the challenge you mentioned, is that for most folks with elevated blood pressure, they may not have any symptoms to begin with. But the reason why it's so important for us to detect high blood pressure and intervene and treat is because hypertension is one of those few contributing factors to the major causes of death and disability in this country. So, strokes, heart attacks, kidney failure, all of these are produced really from years of high blood pressure. And for that reason, we have the ability to intervene early to keep people healthy and happy for all the years of their lives. I think you said it very well that hypertension is really just a fancy word for high blood pressure. Blood pressure that is creating extra pressure within our arteries. Our arteries are those blood vessels that bring oxygen and nutrients to all of those most important organs in our body. Our brains, our eyes, our kidneys, our extremities are all impacted by downstream effects of elevated blood pressure over time. So if we can check people's blood pressure and help them understand when it's above goal, and really understand all the ways that we can intervene, like I say, we can prevent a lot of hardship.
Great. And you said it very well. Untreated hypertension causes a lot of organ damage. And for that reason, we're here today as a collaboration with our health centers and Pima County Health Department. Dr. Cullen, can you tell us a little bit about the collaborative that we're engaging with, and also some of the public health implications of hypertension today?
Yes, thank you. I also want to echo what Dr. Soltani said. Hopefully, we're all in this period of recovery and the development out of the COVID pandemic of a lot of resiliency. That's why this discussion, I think, is so important. As we move beyond COVID, we need to remind ourselves that there are chronic diseases that are really the major contributors to mortality, that's death, in the counties, as well as what we call years of productive life lost. And Dr. Soltani alluded to this, that treatment of hypertension is not just to prevent the sequelae of people dying, but of having what we call morbidity. So of stopping the onslaught of strokes, of stopping people from getting heart attacks and living with chronic diseases after that. So as part of that, Southern Arizona, which, as you know, is the best part of Arizona, is working together to develop a Southern Arizona Hypertension Control Collaborative. What we hope we will be doing, and hopefully with the viewers of this can also help us, is achieve hypertension control in the southern counties. At this point, that would be Cochise, Santa Cruz, and Pima County. What we know is that those county borders are a little unclear. People go back and forth between them, especially if they need to be hospitalized for tertiary care in the Tucson area. So our hope is by working with the healthcare systems, with the federally qualified health centers who are supporting this webinar, with individuals in the community, with organizations like the American Heart Association and other community-based people that are working to ensure that people live healthier and longer lives, will be able to address hypertension, get the hypertension itself under control, and that we'll be able to see the impact of that in the near future.
Thank you, Dr. Cullen. And one of the goals of this presentation is precisely that, is to enhance the awareness of high blood pressure or hypertension, mostly in adults, but it does happen in children too. We have a number of situations that elevate blood pressure in children. And we're going to come back to Dr. Williams and Dr. Mel to specifically address that in a little bit. Dr. Soltani, there's been a lot of work done in the last few years about measurement of blood pressure. First, to make sure it's measured correctly. Sometimes we don't do it correctly. There are specific recommendations by CDC on that, and we'll review that in just a moment. But can you tell us about what's normal for blood pressure? Does it depend on certain conditions? And what is our goal sometimes? What are we trying to achieve without lowering the blood pressure too much, particularly among certain age groups? So can you comment on that?
Sure, sure. Oh yeah, I would love to talk about this. And I think, part of it is that people, we've made it a little bit confusing sometimes because we talk about these various targets for different people. And so to some extent, I try to simplify it in my mind. We know that what is called stage 2 hypertension, which is really the most dangerous type of high blood pressure, is anything that is 140 as the top number, over 90 as the bottom number, or above. So in my mind, that's a red line that I don't ever want us to go above, that 140 over 90. So what do those numbers mean? That top number is what clinicians will call systolic blood pressure. That top number is really the pressure in your arteries as your heart is in full pump. So as it's pushing the blood through those muscular arteries, that top number is called systolic number. And we want that to be less than 140. The bottom number is when the heart is in its rest phase. That's the diastolic phase. And that number, we'd like it to be below 90. So in my mind, that's kind of that red dividing line. But just as you say, there are many other numbers that we try to aim for that are significantly below that. Because again, when we're talking about a 20-year-old or a 30-year-old, and we're hoping for 50, 60, 70 more years of excellent life, the lower is the better. So when you have a lifetime of a heart that's pushing against all that pressure, we want that pressure to be as low as possible while still not having too much dizziness or fatigue. And so in that way, I almost never talk about a blood pressure that's too low unless we're talking about somebody who is very ill or has a fever or for some reason is artificially low. And you're exactly right that sometimes when people have advanced diabetes or advanced heart disease, we might be aiming for a blood pressure that is lower than that 140 or over 90. But I use that as kind of just an easy number for us to remember that we're trying to always aim below.
Yeah, and I think you covered my next question, which is precisely there are conditions that bring challenges to us. And in those conditions, it's very important to normalize blood pressure. So those are people who have pre-existing heart disease, people with prior strokes, and more importantly, in people who have chronic kidney disease.
Correct.
Because we know that progression to more advanced kidney disease will depend a lot of it on management of blood pressure. So you're right.
And sometimes it's just very hard for somebody to know truly what their blood pressure is because, for most of us, we might see our primary care provider couple times a year, and there might just be just 2 data points, and that's probably not enough information for us to really know about our own health. 2 points in time compared to all the moments of our life probably are not enough information. And I think that's partly why you were speaking about self-monitoring of blood pressure. And hopefully folks in our community have heard quite a bit about this. This is a very big initiative with the American Heart Association and with Million Hearts. And it's precisely that at this point, we have the technology for people to be able to take charge of their own health and their own well-being. And that would be, and hopefully, I'm not sure if the camera can see this, but there are a whole variety of home blood pressure monitors that people can purchase now. And there's even some great resources to know. Sometimes when you're at a pharmacy or at the swap meet and you're looking at all the different monitors out there, it's hard sometimes for us to know what is a good quality, reliable monitor. And the American Heart Association has done us a great favor by producing a list that people can access for free online that are called validated blood pressure monitors. So that means that a lot of investigation has been done to make sure that these blood pressure monitors measure correctly and that they maintain their calibration or their ability to measure correctly over time. So the monitor that I'm showing is one brand. It's certainly not the only brand. But in general, the recommendation is that we try to find a blood pressure monitor that measures our upper arm. That is most likely to be the most accurate blood pressure measurement. And most people can find a monitor that is appropriate for them. Many of these commercially available validated cuffs are adjustable, so you don't have to worry that you're not getting the right size for most people. And you can slip it on over your arm onto a bare skin arm, at least 2 finger breadths above your elbow. And then the challenge is how to measure correctly. That is something that's important to take into consideration. Do you have a minute for me to talk a little bit about that?
Absolutely. That's really important to make sure that the blood pressure is accurate because that determines what to do. And if it's
That's
not accurate, it's and also if you wouldn't mind after that touching briefly on the importance of measuring blood pressure perhaps in an ambulatory setting that is not necessarily the doctor's office. There's a lot of movement. It's very fluid right now on looking at blood pressure, not just in the office, but also outside the office.
Sure, I love that. So, and I think, just as you say, outside the office, a great opportunity is in people's homes. We would like to know what your blood pressure is when you're in your normal setting, in your normal activities of life. That's going to be much more reflective of what's happening in your body than the 1 or 2 times that I might have the honor of seeing you in my clinic. So having one of these monitors, and then recognizing that, making time to check a blood pressure when you're in your optimal resting circumstance. So that would be being able to take some time out of your day to sit quietly for 15 minutes, sit in a chair with your feet on the ground, with your arm resting at approximately heart level. So if you have like a dining room or an end table that you can rest your arm, palm up, and slip your cuff on, as I said, a couple of finger breaths above your elbow. Take some nice, deep, calming breaths. Hopefully, you're not a smoker. Hopefully, it's at a time when you haven't just had a big slug of caffeinated beverage. And then take that blood pressure. These monitors don't require you to have a stethoscope. It's just a finger press button that inflates the cuff. And then it's lovely because it'll give you an electronic readout of that top number systolic, bottom number diastolic, and sometimes even your pulse. And most of these validated blood pressure monitors also have a memory function, so that then you don't have to try to find a piece of paper to write and collect those blood pressures. If you collect the information on your monitor and bring your monitor into your doctor, they will be so happy to take a look at those numbers with you and be able to know really quickly how things are going at home for you and how your blood pressure is doing at home. So I love it. I cheer when my patients bring their monitor into clinic, because that means then I have a lot more information to go on than just that one blood pressure when they came in the office. The other thing I wanted to try to help our listeners understand is that it's normal that when we're racing to our clinic visit and trying to get through traffic and making sure the kids have what they need before we head out the door, by the time we get to our doctor's offices, we're often, in a rush, maybe a little bit of anxiety there. And that first blood pressure may be higher than what is really normal for you. So I always try to remind my patients that if their first blood pressure is elevated, that we give them a minute to rest and relax and just, get a new steady state. And then we recheck their blood pressure. And I really ask my patients that if they go somewhere else, the dentist's office, and the dentist is saying to them, well, I don't think I can do your dental care today because your blood pressure is high, that they ask, for a minute to calm and collect themselves and for a recheck, because we know many times that recheck blood pressure will come down significantly. The reason why this is important is we just talked a lot about how we wanted to intervene very, aggressively in some ways. We want to intervene proactively to bring people's blood pressure down, but we need to know that that information that we're working on is correct. So we don't want to overtreat people. So if I just took that first blood pressure that my patients walk in with and said, oh my goodness, I'm going to treat to that number, that may mean that I'm overtreating people because that may not actually be their normal blood pressure.
Great, thank you. And I have one question for Dr. Cullen and then Dr. Williams and Dr. Mel. Dr. Cullen, we have a lot of people with high blood pressure in this country. The public health implications are very, very significant. And I know that various groups are trying to enhance the awareness. Can you speak a little bit about um, your role as a public health leader in hypertension and what leaders like you can do to help our providers, our patients understand not just the importance of it, but how essential it is that we choose the right treatment?
Yes, this is a really important question. I want to follow up, and it's a great question to ask after what Dr. Soltani just said. When we look at public health or population health issues, we look at what we call a cascade. You can think of it as a waterfall, right? And obviously, with hypertension, one of the major things is education and prevention. So, eat a healthy diet, don't eat a lot of salt, make sure you get exercise. Those are things that you can do to prevent the onset of hypertension. The next step, however, is being screened, and that's what Dr. Soltani just shared with you. We believe that there are many people in the counties, the Southern Arizona area, that don't get regular screening for hypertension. Remember, 1 year you can be fine, and 18 months later, you cannot be fine. You can now fall into one of the stages of hypertension. So ongoing attention to getting your blood pressure checked is important. There are many ways to do that. Most fire stations do that. There's many cups at Walgreens or CVS or your local pharmacy, even your local healthcare provider. You can walk in and just say, can I check my blood pressure? After you have your blood pressure checked, then there are a few other steps that happen before you get diagnosed with hypertension. But once you're diagnosed with hypertension, then what we want to do is ensure that you get access to treatment, like you spoke about, and that your treatment controls your disease, right? Because you can be on medication, either not be on enough medication, or things change. You get older, there's other things happening in your life. And so you need to make sure that you get ongoing care. The role of the public health departments in Santa Cruz, Cochise, and Pima County are really to ensure that we have a way that you can access all those services. In Pima County, the public health department provides direct care. In the other counties, sometimes they do, sometimes they don't throughout the United States. It's not consistent, but the most important thing from the county perspective is that we work with you, that we look at things from an individual, what we call the N of one. You're the N of one. You're the person that's really important to us, but we take care of you within the population. So when we look at hypertension, and Dr. Soltani has been helping us do this, we look at what are we seeing throughout the community. What we know is in some of our counties, we have an unacceptable level of people that have uncontrolled hypertension, meaning they're in that level 2 that Dr. Soltani talked about. So our role is to make sure that we can connect you, so access to care, screening for care, education, support for not only you, but your family and your community. And then finally, making sure that people are enrolled in whatever kind of healthcare plan they can get in, including Medicaid, including access in Arizona, to make sure that people can continue to get care. Dr. Soltani talked about this. This isn't one time and you're done. This requires an ongoing relationship with the healthcare system and with your family, right? Everybody wants people to stay healthy.
Thank you. Absolutely. Thank you for that. And I think as a healthcare provider, sometimes we're frustrated when we see patients who are in the emergency room, perhaps with organ damage. It could be a stroke, and we check the blood pressure is 170 with 110. We look at the retina, they have hypertensive retinopathy, which means they have untreated hypertension for a long time. And now we're seeing the end organ damage, which we wish we could have prevented a long time ago. So that's exactly right. I will bring Dr. Williams briefly and Dr. Mel. Dr. Williams, Dr. Soltani spoke earlier about high blood pressure and the different numbers, systolic and diastolic. In children, it's different. Having said that, it's really important in children to recognize early issues regarding blood pressure. Um, there are some conditions which are rare, but we want to identify in children. Anatomic issues um, at the level of the aorta, like coarctation, that sometimes can present with uneven blood pressures in the arms and legs. And you comment a little bit about how age affects blood pressure. And then I'm going to ask Dr. Mel to mention briefly a link between weight and hypertension. We're seeing more and more adolescents with a rise in blood pressure because of the weight. But Dr. William, can you address the issue of the age, please?
Of course. So, in general, as kids get older, the blood pressure naturally increases. So, just as an example, the average blood pressure for a newborn baby is 60 over 40. And that number, again, it gradually increases over time. So, as pediatricians, whenever we say someone has hypertension, we look at what their blood pressure is really before the age of 13 and after. So before age 13, then hypertension is basically stage 1 is being in that 95th percentile, which is again based on age. So there's different charts that we use. Over the age of 13, then the blood pressure really, hypertension really matches the adult definition, meaning that 130 to 139 systolic, 80 to 89 diastolic is what we call stage 1 hypertension, just like in adults, and stage 2 is 140 over 90. So also in pediatrics, it's really important for us to determine what we call primary causes of hypertension and secondary causes. So primary causes of hypertension are some of the things that have already been discussed, such as obesity. But as you mentioned, secondary causes is one of the things that we as pediatricians have to look out for. So you actually mentioned one. So coarctation of the aorta is one. It's basically where you have narrowing of one part of the aorta. So for those kids, they're actually going to have higher blood pressures in the upper extremities. And then in the lower extremities, they're going to be very, very low. Sometimes they're not even, can't even calculate a blood pressure. They're also going to have decrease of femoral pulses. Hyperthyroid is another common condition that can cause hypertension. There's some genetic diseases like neurofibromatosis, which can cause elevated blood pressure. There's kidney disease, like autosomal dominant polycystic kidney disease, very fancy term, but it can also cause hypertension.
And in those too, we're very aware of those secondary causes because once in a while you'll be able to treat that. In some cases, they still need medication, but in some cases, maybe the amount of medication will be less, either as a dosage on the number of drugs. So it's really important to identify those. And I'll come back to Dr. Soltani in just a moment. Dr. Mel, thank you for joining us. In your pediatrics practice and in general practice, our kids are gaining weight, lack of activity, things like that. Um, do you see an elevated blood pressure on those kids once in a while? What is your opinion about the relationship between the weight and the blood pressure? What are your thoughts on that?
Yeah, thank you for inviting me. So as I think we all know, obesity, the prevalence of obesity has inclined or has increased over the last, several decades. And certainly the pandemic didn't help things. So as part of routine pediatric practice, all of our patients have their blood pressure measured, but back to Dr. Soltani's point earlier, sometimes that can be challenging, especially if the child is not cooperative or it says ideally the child is sitting calmly while they're getting their blood pressure checked. So putting all of those factors aside, we still know it's very important. And definitely the weight is a risk factor. So when a child has a BMI above the 95th percentile for their age, just puts them in a different category of risk for not only hypertension, but pre-diabetes. So unfortunately, yes, we are seeing some of these more adult, quote, adult chronic conditions appear in adolescents, especially, and young adults, because we see patients in pediatrics in our health center, we see them until they're 22. So often we are starting to see these comorbidities and having to, initiate management or refer to an adult clinician if we need that help to get them started on medication if that's the appropriate course. But yes, unfortunately, we are seeing an increase in prevalence.
And the weight also causes an increased risk of insulin resistance, which is also linked to high blood pressure. So I think there are various links to the weight and diabetes and high blood pressure. Thank you. Dr. Sultani, sometimes we forget the importance of checking at least one time blood pressure in both arms and the legs. We see rare diseases, but you can really have a heavy impact on one single individual if you identify very rare conditions that literally take a few seconds to diagnose. Dr. William mentioned coarctation. We can do that by either blood pressure or pulse check in the arms and the legs. But there are other rare conditions at the upper body, subclavian arteries. Can you comment on the importance of blood pressure measurement in the arms and the legs? What are your thoughts on that?
Sure, I'd be glad to. And this also comes up because we have people who find it very uncomfortable even to sometimes check a blood pressure in the brachial artery. That's the upper arm. So we do, I think it's good as a person to know that your blood pressure has been checked in both arms at least. That's relatively easy to do. And if there is a significant difference, to really try to do your monitoring in the arm that has the higher blood pressure. But you're exactly right that sometimes we can be born with a narrowing of one artery that makes that blood pressure look higher than the other side, or sometimes we can develop it over time because we have deposition of cholesterol in that artery differentially, or scar tissue. Maybe somebody's had radiation therapy and that's put some scar tissue there. So I do think, although, as you point out, and in the large number of people who are facing high blood pressure, this is probably a relatively small number. But as you point out, these are things that we might be able to intervene on to make a real difference in people's lives. In general, I really try hard to get my folks to use their upper arm blood pressure monitor. But when that's not possible, now there are validated wrist blood pressure cuffs. Those are, certainly more convenient for people because they don't have to worry about trying to move their sleeves around too much, or it might be more comfortable. But before people rush to get their wrist monitor, I just want to caution people that many of those are not validated monitors. So before you buy a wrist monitor, check that American Heart Association list of validated monitors to make sure that you're choosing one in the wrist that is validated. In general, when we're checking blood pressures at the distal part or the end part of our extremities, either the wrist or the legs, we're going to get blood pressure numbers that are higher than the blood pressure that we get closer to our heart in our brachial artery. And sometimes that can be the difference in 10 points. And, for our very astute listeners, I know they'll immediately say, well, that's the difference between a normal and stage 1, or the difference between stage 1 and stage 2. A 10 point change in blood pressure is significant. So it's important to know that the way that we're monitoring our blood pressure is correct and is corresponding to the real blood pressure that our organs are facing.
Now the patient comes in to the office. He or she has detected high blood pressure at home. They come to the office, it's high, so it's high. They come to the office. What can they expect in the office as a doctor and you see your patient? What are the kinds of things you are alert to in your physical exam? What are the kinds of things that you identify as you examine the patient to help you guide treatment, not just guide treatment, but also recognize certain conditions that maybe a laboratory work could do? And, I'm just going to touch briefly on one, and I would like for you to touch on the others. From sometimes we see someone with a goiter, for example, that was told she had a large neck, and it was because of a large goiter. And we know thyroid disease, either hypo or hyperthyroidism, has been linked to high blood pressure.
Sure.
But as you examine your patient, what are you attentive to? What are the things you look for?
Well, first of all, if my patient came with a home blood pressure monitor to show me that their blood pressure was high at home, I would cheer. The first 5 minutes of the meeting would be cheering. So thank you for pointing that out. But you're right. I mean, we're really looking for any signs that high blood pressure is doing any harm to other parts of the body. So sometimes you might have an eye exam where somebody shines a light in your eye. They're looking at your blood vessels in the back of your eye, your retina, to see if there's any narrowing or what we call nicking. Those are changes in those small blood vessels. When somebody's walking into the room or talking with me, I'm looking to see if they have any signs that they might have had a mini stroke or, some kind of weakness in any part of their body related to high blood pressure. I might be listening to their carotid arteries to see if there's any narrowing or what we call a brewery in their arteries of their neck. I'd be looking for any signs of heart failure. So do they have any fluid in their lungs? Do they have any swelling of their legs? So I might be looking at all of those things. Mostly, I'm also going to be rechecking their blood pressure at least one other time. And so I don't want our patients and our community members to feel frustrated if they're like, my gosh, didn't she talk to her nurse? Her nurse already checked my blood pressure. But it's really to reassure people that we're trying to get the most accurate information we can before we make a lot of decisions that might change your life. So we want to be careful that we're doing that. Just as you pointed out at the very beginning of our conversation, is that fortunately, hopefully, we're catching blood pressure before we're seeing a lot of physical exam findings other than the elevated blood pressure. So my prayer is that we're detecting your blood pressure and controlling it before I see any changes related to heart failure or stroke or some retinal eye damage. And so as part of that, we're doing blood testing. So we're testing for your kidney function. We know that kidney and heart are inextricably linked. They really work together to maintain the levels of pressure in our body. So we're checking kidney blood tests. Sometimes we're checking urine, particularly if I've detected an issue with the kidneys. We're checking the urine test to see if there's protein or other kinds of abnormalities there. We're checking cholesterol because we know that cholesterol plus blood pressure can cause real damage in the body. So if I know I already have an issue with blood pressure, I'm checking to make sure that the cholesterol is something that I might need to treat, and the sugar might be something that I'll need to treat. So we're looking at all of those things. And as you point out, if I don't see that there was a thyroid level done at some point, we'll add that on as well, just to make sure.
Thank you. And now we measure blood pressure, we look at it, and we're going to talk about treatment in just a moment, the non-pharmacologic and some medication. I want to come back to the pediatricians in just a moment. When you see an adolescent, a child with high blood pressure, that's an alert to a family commitment. Something is happening, perhaps, that we could deal with as a family. I want to ask maybe Dr. Melk, when you see an adolescent who has a weight issue and blood pressure is high, what kind of engagement do you do with the family about that? I suspect that, if you have an adolescent with a blood pressure that's high, we need to look at other family members as well. There may be a component as well in terms of family history. And as a pediatrician, you have a lot of impact on the future health of those individuals. Can you comment briefly on family involvement in that case regarding weight and perhaps high blood pressure?
Yes, definitely. As pediatricians, and honestly, one of the reasons I became a pediatrician is because I believe strongly that it's much easier to prevent chronic diseases than it is to treat them. And that's obviously the ideal scenario. So thankfully, as I mentioned earlier, not very many of the children that we see, a minority of them actually have a diagnosis of hypertension. But what we're trying to do at every well visit, and it's one of our quality measures, so we track this, is measure their BMI and counsel on nutrition and exercise at every visit. And the counseling isn't for the child, honestly, it's for the family or the caregivers, right? Because we know that the context that the child is living in is their reality. It's the food choices, it's the, how active they are really, really is dependent on the family. And so a lot of it is understanding and taking the time to understand the social context that the families live in. We serve in an area, well, we have a very large service area. And in one of our clinics, about 85% of the children qualify for Medicaid. And we know that poverty itself is a risk factor for any of these conditions that we're talking about. And so rather than dive in and talk about how they need to go eat organic vegetables, we need to understand sort of what is the social context of that family and what might be a more sensitive way to approach the issue. Thankfully, we work with a team. So I often will refer to my registered and give them some, easier, more tangible ways to try to approach the problem. We also have, if we're fortunate enough, in some of our clinics, we have integrated behavioral health providers who can also talk a little bit more about the behavioral changes that need to happen, because we know a lot of these are patterns of behavior, and that's just difficult to change for anyone. But I think when we focus in on the future health of the child, that's when I see families and parents, caregivers, really be more willing to make those changes, because they, the child is innocent, right? In the sense that they are subject to the decisions of the parents. And so I think that's the family, recognizes their role and the caregivers and the adults in the child's life, and then they understand the importance of making changes. But it's difficult nonetheless. We haven't found a one size fits all solution. But yeah, I think it takes kind of that comprehensive approach, and working with our team.
Thank you, Dr. Malik. And Dr. Cullen, public health has a lot of influence on some of the non-pharmacologic treatments, diet, exercise. Your role as a public leader, a public health leader, is essential for that. Can you comment a little bit on the resources available where our viewers and listeners can go to look at specific items that would be helpful in terms of the traditional non-medication treatments that are available?
Yeah, this is a great question. And all of our counties work in this area, though you may not think of it that way. So think of your parks and recs people. Think of all the classes that are being offered by Parks and Recs. Think of the development of walking trails, especially now that it's getting cool. I wouldn't recommend this in the middle of the summer, but that we know that exercise is really an important part of keeping healthy and trying to prevent the onset of hypertension. In addition, we know that healthy nutrition matters. And I'm sure Dr. Mack would talk about this with the Women and Infant Children program, which is a nutritional supplemental program really designed to keep pregnant moms and infants and young ones healthy. So that's another great place where you can get appropriate nutrition information. So eating healthy, exercising regularly. I would encourage you to use your public health department. At least the Pima County Public Health Department has lots of information on there on how to stay healthy, how to keep our community overall engaged in activities that we think are important for trying to prevent hypertension, trying to keep families healthy. Remember, we say this repeatedly, that it's the community that helps engender health. And that community is made up, once again, the N of one, the individual, but also the family. So making sure that the decisions about what to eat, how to eat, and when to exercise are part of that. The other thing I would say is that despite economic pressures, there are opportunities available. So if your family, for instance, receives SNAP food benefits, there's lots of information available, and SNAP can now be used, as probably most of you know, to go to food markets and to make sure that you buy appropriate produce. Anybody that's on this call, however, who has a little one or is a pregnant mom, I would really encourage, if you're not on WIC, I would encourage you to seek out enrollment in WIC for a couple reasons. One is the WIC counselors are very well informed on nutritional education and appropriateness of food choices in that pregnancy and in that early age group.
Thank you for that, Dr. Cullen. Dr. Williams, as a pediatrician, you engage family in your visit. The kids come with their parents, and many of them share with you chronic conditions of family. How do you see the family coming together in not just identifying a child with has risk of hypertension, but how do you work with families to bring them together to look at chronic conditions such as hypertension?
It's a great question. I think similar to what Dr. Milk mentioned, it really has to be a team approach. So, a lot of times I'll get the entire family member, meaning that even though the mom or dad may be at that initial visit, I'll say, hey, I know that you live with grandma. I know that you live with your aunt. I really want to talk to all of them, and let's kind of work together to help develop a plan. I really encourage getting out. Screen time is a major issue, and I think sedentary lifestyle is also an issue. So I really tell parents to track your screen time. There are now apps and other features on phones. You can even turn off the phone whenever they've reached a certain limit. So I encourage them to get out. I think sports is another great way, just like the group has mentioned. So I tell them to look at their local resources to see what opportunities are available. And then I think also, we're lucky at community health centers because we have a lot of built-in resources. Just at Mariposa, we have a healthy eating program where we teach kids and families how to cook healthy. We have all these different things that can come together, again, just to assist the families.
I think this is a family issue. I think hypertension can make it a family issue in terms of exercise, weight management, diet, a reminder about taking medication, which we'll touch on in just a moment. So it's really a family issue. And if it's seen that way, I think the chance of success will be higher. We're going to talk about a couple of things on treatment. I just want to remind our viewers and listeners that every decision on this, particularly in terms of treatment, should be consulted with your primary care provider. There's so many variables in the management of blood pressure that it's really essential that you consult with your primary care provider. What we're going to tell you in just a moment, and I'll ask Dr. Soltani, they're very general recommendations, but individual decisions are based on your history and other aspects of your clinical care. So please consult with your provider before before a recommendation is made. I think that's essential. The medication is chosen for you may depend on various factors. And I want to go back to those two areas before we start wrapping things up. Dr. Soltani, before we began our meeting today, you show us some literature on lifestyle management of blood pressure, which is essential, and the outcome of those. Can you comment on the importance of treatments that are not medication necessarily? And then we'll touch on medication.
Sure. Let's see. Let me see if I can share my screen here. One thing that I find very exciting about ourselves as individuals and families, how many adjustments we can make in the ways that we live our life that can be very powerful for controlling blood pressure and maybe just as powerful as any of the medications that your primary care provider can prescribe to you. Dr. Perea, is the infographic up?
Yes. Yeah, we can see it very
Okay,
well. Thank you.
perfect. So I just want to give a shout out because, our colleagues mentioned so many wonderful resources for information, and this is one more. This is produced by the American Heart Association as part of a website called Target BP. Target BP. And there are so many beautiful resources for individuals to look at, to be able to share with their families, and also clinicians of all parts of clinical care to be able to draw upon as we think about the various ways that we can help to manage high blood pressure. And as I was listening to Dr. Williams and Dr. Malk talk about, these many lifestyle changes that they like to discuss with their families, I was just reflecting that not only do those changes help to improve blood pressure, but they really help to improve many of the long-term this nation, diabetes and arthritis and Alzheimer's or dementia. Many of these interventions in terms of increasing our physical activity and reducing our sodium, looking at having more fresh fruits and vegetables in our diet, those kinds of things can really impact many of the conditions that we could hope to prevent later on in our life. So if I can convince you to take a minute to Google Target BP, you'll see that there are many resources like this in Spanish as well as English and other languages. But I think in this one, you can see just the incredible impact that, incremental or little by little changes we can make in our lifestyle can improve things. And the reason I think all of us have talked so much about this is that, our lives are so challenging. We're balancing so many things, our work hours and our kids' school schedules and all the things that we need to get done in our day. And it's very difficult sometimes to change the way that we eat or change how much physical activity we can get. And So one is, giving yourself grace, understanding that, it's not possible for any of us to make just overnight changes in all of these, but really to choose one goal and think a little bit about how you can incorporate that in your life and in your children's life, can be super successful. And really anything as parents that we demonstrate to our children, hey, it's the weekend coming up, let's all go on a hike at Mount Lemon, or hey, let's try a new recipe. Let's see what happens if we don't put the salt shaker on our table today. And just, congratulating each other for the effort that takes, and the long-term impacts and benefit that will make in our life. So I'm going to stop sharing this, but hopefully you all will have a chance to take a look at those resources and see how those might be helpful in your life as well.
I just want to emphasize the magnitude of the blood pressure drop with the DASH eating plan. It's the most effective in lowering up. And in some cases, when the elevation of blood pressure is relatively mild, that perhaps could be enough. And so doing all of that could be enough. So next is medication. We have a lot of medications available. We're not going to have time to cover all of them. We choose medication based on various factors. We have guidelines from various groups that tells us, the doctors, which medications to use. But those are guidelines. We may choose to use one versus the other based on a number of conditions. The one that frequently happens is gout, for example. The presence of gout may move us in a different direction with one class versus the other. And so that's how we choose. But Dr. Soltani, can you comment on the importance of medications, and perhaps if you could just to choose one category of medications and perhaps cover the side effects, not to a great extent, but it does show you the kind of decision making that the doctors need to go through to choose the right drug for you.
Yes, I'd be happy to talk about that. And really, I'm not going to give really a laundry list of medications, just as you point out, just to emphasize that at this point, we have had, I think the last time I looked, it was 200,000 studies a year on heart-related topics, where researchers have systematically looked at all kinds of different medications, their risks and benefits, and not just in the first 3 months, really what happens to people after 10 years on some of these medications and regimens. People should be reassured that we're not making these decisions based on, what commercial we saw that day, or, what our friends might be on, that we really take into serious consideration the other conditions that we're treating and the risks and the benefits. So, is this a person who also has diabetes? Is this a person who also has heart failure? Is this a person who might have kidney disease? Do they have gout? Are they potentially going to get pregnant? These are all things that we need to be very careful that we're thinking about. And I really do want to caution, people of childbearing age. If you're in an age range where you might accidentally get pregnant, really challenge your healthcare professional that, is this safe? Sometimes we never know when we're going to get pregnant, and we might not know that we're pregnant up until the first couple of months. And so it's important that we're on medications that are not going to cause harm to our developing fetuses. So please, that would be the one thing I would just ask people to really, challenge their clinician to think about before they land on a medication. I will say, though, that what I'm very excited about in the realm of medication are these things that are called fixed dose combination pills, or combination pills. And I think the reason why I'm excited about them is because with a single tablet, we can provide to a person two or more chemical compounds that are designed to be given together, that really together create a better impact than either of them individually would. Because of the way they work together, they work on different parts of the body, or the mechanism for high blood pressure. And because of that, when we combine them in one pill, we're able to use much lower doses. And when we use a lower dose, we can expect fewer side effects, for example. And we can also, because we combine those two things together, we can expect that we will get to a goal healthy blood pressure faster with fewer numbers of tablets. And if you have to pay a copay on your medications, fewer copays, right? Because you're just going to pay a copay on one bottle of medication as opposed to 2 bottles of medication. And so, if I love it when my patients ask me and come with ideas about what they would like to see for their own health. I think that is just wonderful. It takes some of the, pressure of me trying to imagine what this person wants for their life. If they're telling me what their goals are and what they want to do, that is just really a joy for me. And I know from my colleagues, because that helps us to get to the right answer much faster. So these are just a few things that I would mention about that.
Thank you for that. And also, a patient can ask for about 90 days worth of medication. Many plans will cover that. That will reduce the number of trips to go to the pharmacy, et cetera, so it can improve the adherence to medication management. Great, great. What a rich discussion. What a rich discussion. It's been a fantastic, productive session today. I think we're going to wrap things up. I'm going to have each of our guests make some closing comments, and then I'm going to thank our team. Dr. Cullen, you want to give us some final comments after a very rich discussion today?
First off, kudos and thank you to everybody for joining, but also for this amazing people that put this together. We're always welcoming the opportunity to talk about the impact of clinical care on public health. I would remind you that your public health department is a wealth of resources. Please reach out and make sure that you use us appropriately. Thanks.
Thank you. Dr. Williams, any final comments?
I would just say that I think the good news in pediatrics is that many kids who have elevated blood pressures do not require medications. In 2017, the American Academy of Pediatrics published guidelines for the management of hypertension in kids. And basically it says that unless you have someone with stage 1 hypertension or stage 2 and symptoms of in-organ damage, then typically they don't require treatment. But if you do see some of those worrisome signs, then they may. I would also say that there's important things to look out for in terms of warning signs for kids that have hypertension. So, for instance, if you have severe headache and hypertension, if you have focal weakness, if you have visual changes, mental status changes, those are all things that should really prompt a visit to the ER.
Thank you, Dr. Williams. Dr. Soltani.
Well, I'm just so grateful to be here with just fascinating colleagues I've learned so much from today, and just want to remind everybody in the community that this is a place where we all can play a big role. So just asking what your blood pressure is, knowing what your numbers are, looking for ways to monitor at home, looking at some of the resources that we suggested, that Target BP, the National Association of Community Health Centers have YouTube videos and a number of different things in Espanol and in English, and just the many ways that we can make some changes in our lifestyles to bring us to a healthier outcome, just for ourselves and our families and our community. So thank you so much for inviting us.
No, thank to all of you. Dr. Melk had to jump off to another meeting, so we want to thank her as well. And I want to make aware to our viewers and listeners that this is part of the Hypertension Collaborative in Southern Arizona. We're joining forces with El Rio Health, the Pima County Public Health Department, Chiricahua, and other health centers to enhance the awareness of elevated blood pressure, how to screen for it, how to make a diagnosis, and make some suggestions about management. And Mariposa is just very grateful to join others in this initiatives as part of our community education. I want to thank Edgardo Munoz and Marco Leon who made this possible. We've been working on it for a little while. We got it done. We're going to have this session recorded and released to the public. We're going to send links to various groups. Feel free to use it at your discretion. We do plan other initiatives to enhance the awareness. This is the beginning of the effort that we'll be doing of community education. We'll probably do some in Nogales, maybe some in Tucson, but be alert to that with the assistance of Dr. Soltani and Dr. Collin as well. With that, I think I'm going to close our session. Thank you very much to all our guests. It's been a privilege to work with you today, learning a lot today. Thank you very much. Have a great rest of the day, and we'll see you soon.